Hi everyone, in today's video we are going to be talking about what depression with psychotic features and what bipolar with psychotic features are. Hi, and welcome back to the channel. My name is Lauren, and I make videos about what it's like living with schizoaffective disorder and schizophrenia. If you would like to see more videos from us, make sure to subscribe. And also, if you would like to help support us in creating this type of educational content, please check out our Patreon page. The link is in the description below. Once you become a patron, you also gain access to our private Discord server where we offer weekly peer support groups, as well as access to peer support through various mediums such as text and voice channels. If that interests you, make sure to check out the link to our Patreon page. Also, I just want to give a huge shout out and thank you to all of our current patrons. We could not be doing this without your support. Okay, so what are depression and bipolar with psychotic features? Depression with psychotic features, also called psychotic depression, and bipolar with psychotic features are subtypes of major depression and of bipolar disorder, respectively. They occur when a severe depressive or manic episode includes some form of psychosis. According to the National Institute of Mental Health, someone who is psychotic is out of touch with reality. Psychosis could include hallucinations, such as hearing voices or seeing things that are not really there. Delusions, which are essentially false beliefs not grounded in reality or false perceptions, or some other break with reality. Major depressive disorder, or MDD, with psychotic features is associated with significant morbidity and mortality, but often goes underdiagnosed and undertreated. It occurs in nearly 18.5% of patients who are diagnosed with MDD and affects roughly 1 out of every 4 people admitted to the hospital for depression. People experiencing major depression with psychotic features may get angry for no apparent reason. They may also spend a lot of time alone or in bed, sometimes sleeping during the day and being awake during the night. They may have a difficult time keeping up with personal hygiene and appearances. They may also be harder to talk to, or sometimes even barely talk or speak in a way that does not make sense. In bipolar disorder with psychotic features, the psychotic symptoms tend to match the mood episode the individual is experiencing, be it mania or depression. We have a video that goes into detail about what bipolar is and what mania and depression are that you can check out here. During a manic phase, a person may believe they have superpowers or something along those lines. Experiencing psychosis during a manic episode can be dangerous as it can often lead to more reckless or dangerous behavior. With both major depression with psychotic features and bipolar with psychotic features, the psychotic features can present as mood congruent. This basically just means that if a person is experiencing a depressive episode, the content of their delusions and hallucinations will be more depressive in nature along the lines of personal inadequacy, guilt, disease, death, nihilism, or deserved punishment. If a person is experiencing a manic episode, the content of their delusions and hallucinations will be more along the lines of euphoria, grandiosity, etc. People with other mental illnesses also experience psychosis, the most prominent being schizophrenia. However, like I mentioned, depression and bipolar with psychotic features generally have delusions and hallucinations consistent with their mood episode, whereas psychosis and schizophrenia generally entails more erratic or implausible symptoms with no obvious connection to a mood state. The exception is with schizoaffective disorder, which is essentially schizophrenia combined with a major mood disorder, such as depression or bipolar. The difference between schizoaffective disorder and depression or bipolar with psychotic features is that with schizoaffective disorder, the psychosis occurs even when no mood episode is present. People experiencing depression or bipolar with psychotic symptoms may be embarrassed or ashamed of the thoughts they are experiencing and try to hide them. This is one of the reasons this type of depression and bipolar are more difficult to diagnose. Depression and bipolar with psychosis can be quite serious and the risk of suicide is quite high. Usually though, treatment for psychotic depression or bipolar disorder takes place in the hospital. This allows a safe space to stabilize the person again and under the monitoring of mental health professionals. Medications are commonly used to help stabilize the person and most often include combinations of antidepressants or mood stabilizers and antipsychotic medications. The combination of these medications is significantly more effective than solely using an antidepressant, mood stabilizer, or antipsychotic. Treatment for these illnesses can be very effective. People are often able to recover usually within several months or so. It can be important to keep following up with a medical care team though. So I hope this video helped you to better understand what both depression with psychotic features and bipolar with psychotic features are. If you have any experiences with either of these that you'd like to share, we'd love to hear from you in the comments below. If you'd like to see more videos like this one from us, make sure to subscribe. And just another quick reminder to check out the link to our Patreon page if you'd like to help support us in making this educational content. Thanks so much for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.